topic for discussion will be bladder emptying or voiding dysfunction in women. How common is this problem and what is it? Women sometimes, especially in the elderly age group, have difficulty in completely emptying the bladder and have a feel that they have retained some amount of urine in the bladder. Because of this, they go frequently to the washroom to empty the bladder to relieve themselves of the sensation, and sometimes they acquire the habit of leaning forward, pressing on their tummy, or even straining to empty the bladder. Because the stasis of urine inside the bladder, it causes repetitive urinary tract infection, and bladder doesn't empty fully, and the contractility of the bladder keeps on increasing, and this can cause back pressure in the kidney system, further leading on to either ascending infection or even scarring in the kidneys, blood pressure issues, or even sometimes renal failure. So why does this voiding dysfunction happen, or how common is it? Though common, it is not as common as incontinence. However, it is not such a rare phenomenon. We do get patients, about 1 in 5, who appear in the clinic with this chronic voiding dysfunction problem. It affects all age group, but the disease pattern or the presenting symptom or the cause for it happening in different age groups also varies. Say, for example, younger women, say 30 to 40, have difficulty in voiding and emptying the bladder fully. It is definitely not due to an obstruction in the pathway. It is because of the pelvic floor muscle dysfunction. Women normally void by pelvic floor relaxation. If they start contracting the pelvic floor, the sphincter mechanism closes and the woman is not able to completely empty the bladder. So, any amount of endoscopic procedures or opening up of the passage is not going to help these women, and they should be assessed properly as whether they have any difficulty or pain during intercourse, pain during urination, or pain during defecation as well. And appropriate physiotherapy combined with or without biofeedback mechanisms helps them learn how to do pelvic floor relaxation so they can void without straining. This can lead on to even marital discord if it's associated with pain during intercourse. The treatment for this would be physiotherapy, which is supervised by a trained pelvic floor physiotherapist, along with some skeletal muscle relaxants, as well as cognitive behavior therapy and counseling, which helps them relax the pelvic floor better so they do not strain to pass urine. Take, for example, the menopausal women or the women in the elderly age group. The problem here is the lack of estrogen, which causes significant dryness of the genitalia as well as the vaginal canal. It causes significant narrowing of the urethra or the outlet passage of the bladder. Because of this, they develop a condition what is called urethral stenosis or stricture, and thereby these women are not able to completely void and start retaining urine. They will have burning sensation in and around the vagina. Thinking it's due to a hygiene issue, they keep using all sorts of antiseptic washes and also soap and health faucet to cleanse that area. This causes further dryness of that area, causes denuding of all the good bacteria, and predisposes to them to this urinary tract infection and fungal overgrowth. I strongly discourage women to practice overt hygiene for the genitalia, as this can be detrimental and predispose them to repetitive urinary tract infection. Application of plant-based oils such as coconut oil prevent the dryness-related irritation and burning sensation. Most important is to apply liberally the use of local application of estrogen cream in women who have menopause related vaginitis and burning sensation. This does not have major side effects. However, it should be done with the prescription of your gynecologist, and these women have to be followed up on a regular basis to check out for any possible side effects. Should you have any bleeding while you're using the estrogen cream, immediately consult your gynecologist so we are not missing out on anything abnormal. This particular cream does not cause cancer, especially of the breast, and can be used as and when required and as long as prescribed by the gynecologist. So we have various reasons why women suffer from voiding dysfunction, how to find out why this particular condition is occurring, who are all at high risk, and what measures can be undertaken to prevent as well as treat women suffering from the difficulty in emptying the bladder completely. Thank you.